So latissimus flap breast reconstruction is where we take the tissue from the back, with or without skin, the muscle and the tissue from the back, and bring it around to the front. That can be done either with an implant or an expander. Sometimes it's done by itself, just to add volume to the breast. You will have an incision that goes along the back, generally along the bra line, and then you'll have the tissue brought around to the front. Risks of the surgery: there's a risk of flap failure if the blood supply is insufficient. This is what's called a pedicle flap, where the vessels are not sewn back together, they're just rotated over. The risk of flap failure is exceedingly low because it's not a microsurgery case, it's just moving the tissue over. There's a risk of weakness to the back. I'm always actually surprised at how few patients have weakness, considering that we're moving a major muscle from the back over to the front. What's interesting is that the other muscles of the back tend to take over, and I've never really seen any patient complaining of weakness after you're healed. You can have a contour regularity of the back where you'll be a little bit flatter on that side because we're taking the tissue and bringing it over. If there's an expander or an implant being placed, there's a risk of implant or expander failure, meaning that it gets exposed. It could be from infection, it could be from exposure of the expander, or it could be from something called a contracture, which is where the body forms a scar capsule around the implant, it contracts, and it becomes uncomfortable. But these things are extremely rare. Higher in radiated patients, but the whole purpose of the latissimus flap is to bring healthy tissue over to minimize the risk of that happening. A second stage is generally done afterwards to help shape it to the other side. So I'm generally not overly concerned about symmetry to the contralateral side. If we're doing bilateral latissimus flaps, again, we try and match them as best we can, but often we'll need a second stage for symmetry. And then lastly, with the latissimus flap, there's a risk of a fluid collection or seroma on the back because that muscle is being brought over. You'll have drains in there. Try and avoid any twisting, which could create shearing forces, which could create fluid, but having a seroma there is a possibility. And it's also not uncommon to feel some fullness on the side as the tissue is being brought over. Most of the time it goes away. If it doesn't go away at a second stage, sometimes we'll have to revise that and reshape that.